Okay, so today's is health insurance. So health insurance is just used so that you aren't, if anything medically goes wrong, you're able to get a little bit of help with it. There's major medical insurance. This is something that supplements, meaning you have to add to it. Like my grandma has extra insurance on top of her Medicare. And then co-insurance, if you remember when we did the house or the building, co-insurance just means that you're going to take a little more responsibility than just the deductible. Yeah. Okay. So we have Leela has her employer that offers health insurance that covers her, her husband, and their child. Her total monthly premium is $285, and I put I wish because I wish that was the case in my. So the total monthly premium means that between her employer and her, it only costs $285 a month. And then it says, of which her employer pays 26%. How much does Leela pay for the health insurance in 1 year? So you have to, there's multiple ways, but most of the time today, kids have done the 285 times 12 months. And so that totals 3420. So that's the total yearly premium. Okay. Then the employer pays 26%, so you can do 0.26. And that is $889.20. This is the employer's amount. Okay, so then to figure out the amount that she has to pay, we can just subtract the amount the employer pays, and we get $2,530.80. Another way to think of it could be that if the employer pays 26%, that means she pays 74%. So you could also just multiply it by 74%. Okay, this is a little bit harder stuff. So health insurance benefits and co-insurance. Okay, there are many different pieces that you have to figure out how much somebody owes. So the first part is you need to find the uncovered amount. So that would be the total bill minus how much the insurance says that they will cover. Then there's the co-insurance. So you also use the covered amount, and then you have to subtract the deductible because remember that has to be paid before the insurance will pay anything. Then you multiply that by the co-insurance rate, the percent, and then you just do the uncovered amount that we get up here plus the deductible plus the co-insurance, and that's going to make more sense as soon as we do an example. So we're kind of going to keep the formulas in view. Okay, so then Jolene underwent surgery for an injury. The hospital portion of the bill was $5,298, of which only $4,875 was covered by Jolene's group and medical insurance policy. In addition, the co-insurance amount of the bill was 18%, and the remaining deductible she had for the year was $300. So the deal with the deductible is it's the deductible for a year. So I personally have a $5,000 deductible. So anything that I have to pay for, or any time I go to the doctor or have any medical things, I have to pay it until everything I've paid adds up to $5,000. So she's paid everything, and then she only has $300 left that she has to pay before they will pay. So that is important as well. So we're going to start and do the uncovered amount from the previous slide. So it's literally the total bill. So it'll be the $5,298 subtract So this is the bill. Then we're going to subtract the $48.75, which is the amount that was covered. So then the uncovered is $423. So that's uncovered. So that's something she has to pay. So I'm going to put a little star. Because the question is, how much will she have to pay? So that's going to be part of. Then step 2 is figuring out the coinsurance. So there's a couple steps that have to be done in order to do that. So we have to take our covered amount and subtract our deductible. And just a heads up, this is a huge part of number 20 on your assignment, and it's comes across really, really difficult. So you just need to figure out like what's covered, what's uncovered, things like that, and then it won't be so bad. So $45.75 is the amount that we find the coinsurance on. So we times that by 18%. Rate. So then $823.50 is the coinsurance amount. So she owes that, but she also owes the deductible up here. So those are the 3 pieces that we need to figure out how much she owes. So then we'll move over here. So we'll just add them all together. So we'll take our uncovered from over here. Then we'll take our deductible and our coinsurance. We'll add them all together. And she's going to owe $1,546.50. And while that seems like a lot, it sure as heck beats not having to pay the whole amount. So it's just one of those things. Okay, so then this one is talking about a dental insurance plan. They pay a maximum of $450 for a crown. It also requires her to pay 10% coinsurance. Her policy does not have a deductible. The bill she receives for the crown from her dentist is $1,525. How much of that bill will she have to pay? So we do it very similar to this, except there is no deductible because it told us there's no deductible. So we'll start with the covered, uncovered. So the bill is $1,525. And the insurance says they're only going to pay $450. So right off the bat, she has to pay the uncovered part. So we'll put a star by that. So $1,075 is uncovered. Okay, now step 2, if you look up here, we had covered minus the deductible. Well, this doesn't have a deductible, so we just do covered times coinsurance. So we'll do the $450 times the 10%, and that gives us $45. And that's one she's going to pay. So then step 3 is just the $1,075 plus the $45. So she will pay $1,120. Again, that's a lot of money, but it's not $1,525. So, okay, then there is the assignment. Let me know if you need any help.